my name is Shaidel May Udo. I'm your student nurse from the University of Mindanao. Today I will be performing a vital sign. The equipment that we are going to use are alcohol, 2 jars with cotton balls, with dry cotton balls and with alcohol, pocket notebook, ball pen, watch with second hand, stethoscope, 2 digital for rectal, oral, and axillary, BP apparatus, 2 waste receptacle, and clipboard. The purpose of obtaining this vital sign are measurement provide data that can be used to determine patient's usual state of health. This will include the blood pressure, respiratory rate, heart rate, and the temperature. Check the client's and doctor's order for client's name, frequency, and baseline data. Checking the patient name in chart for latest order for temperature and frequency to ensure the procedure to be done is right. Put some alcohol and observe appropriate infection control procedure. Infection control should always observe and any nursing procedure. Identify clients and explain the procedure to ensure that the right client and let the nurse elicit operate of the client. Excuse me, ma'am. What is your name? How old are you? And when is your birthday? Thank you. So, is it okay to do a vital sign? Provide clients privacy. Provide secure environment to the clients where they receive medical care. Wipe the digital thermometer from the butt to warm the stem with alcoholized cotton ball, then wipe it with dry cotton ball and twist in motion. By wiping the digital thermometer and twisting motion from the cleanest to the dirtiest to ensure contact with the entire thermometer, thereby minimizing the spread of microorganisms to the inferior area. Pat dry the client's axilla using the tissue paper or washcloth. But drying the client axilla could cause inaccurate reading. Turn on the thermometer on and check for the LCD display and ready to use. To check the functionality of the digital thermometer before placing it to the axilla. Place the thermometer on the client's opposite side directed upward and place arm across the chest. This is to secure thermometer in the place. Leave the thermometer in a place until it will emit the sounds, meaning result is ready. Allow time based on the manufacturer instruction and recommendation to reach a maximum temperature reading. Remove thermometer, wipe it using with a dry tissue paper, starting from the stem to bulb. Wipe excess sweat to avoid difficulties in reading the result. Read the thermometer reading on the LCD screen display at the eye level. Reading at the eye level, ensure correct reading. Record result in a jot-down notebook to keep baseline data and to monitor client's progress. Turn off the thermometer and disinfect twice using alcoholized cotton balls from the stem to bulb in a firm twisting motion and store it in a protective case. Oral temperature. Wipe the digital thermometer from the bulb towards the stem in the cotton ball with sterile water, then wipe it with the dry cotton balls. By wiping the digital thermometer in twisting motion from the cleanest to the dirtiest to ensure contact with the entire thermometer, thereby minimizing the spread of microorganisms to the clearer area. Turn on the thermometer on and check for the LCD screen display and ready to use. To check the functionality of the digital thermometer before placing it to the mouth. Instruct the client to open mouth, place the thermometer, and instruct the client to close mouth and refrain from talking. This is to ensure thermometer in place. Leave the thermometer in the place until it will emit the sounds, meaning result is ready. Allow this based on the manufacturer instruction and recommendation to reach maximum temperature reading. Remove the thermometer from the client's mouth. Wipe thermometer using dry tissue paper. Wipe excess saliva to avoid difficulties in reading the result. Read the temperature reading on the LCD screen display at the eye level. Reading at eye level, ensure correct reading. Record result in a jot-down notebook to keep baseline data and to monitor clients' progress. Turn off the thermometer and disinfect twice using the alcoholized cotton balls from the stem to the bulb in firm motion, and store in protective place. Cleaning before placing to its container reduces the spread of microorganisms. Obtaining rectal temperature while the client is in a supine position, assist in same position, and drip for privacy. Proper positioning prevent any injuries to occur and facilitate easy accessibility to the site. Don glove to reduce the risk of exposure of body fluids, minimizing pathogens cross-contamination. Prepare the thermometer. Lubricate the tip of the rectal thermometer to approximately 1 inch above the bulb. Lubrication reduces friction and irritation of the mucosa membrane of the anal canal during insertion. With the dominant hand, hold the thermometer, while the non-dominant hand separate the buttocks to expose anus. Instruct the clients to take a deep breath. Taking a deep breath relaxes the sphincter muscle of the anal and rectum, thus having an easy end insertion. So gently insert the thermometer to approximately 0.5 to 1.5 inches. Release the buttocks to allow the filling in place. Leave the thermometer in the place until it will emit sound, meaning ready. The result is ready. Allow time based in the manufactured instruction and recommendation to reach a maximum temperature reading. Remove the thermometer and wipe with dry tissue, starting from the stem to bulb. Discard used tissue and the waste receptacle. Physics of the thermometer may allow difficulties of reading the result. Read the temperature reading on the LCD screen display at the eye level. Reading at eye level ensure correct reading. Swipe anal area with tissue and cover client for privacy. Immediately discard used tissue in the waste receptacle. Clean the anal area to help prevent the spread of microorganisms. So, record result in a JotDown notebook to keep baseline data and monitor clients' progress. Turn off the thermometer and disinfect twice using the alcoholized cotton balls from the steam to bulk in firm motion and store it in a protective case. Cleaning before placing into the container reduces the spread of microorganisms. Dispose, use gloves to help prevent spread of microorganisms. The lastly is wash hands or put some alcohol to prevent spread of microorganisms. Obtaining radial pulse. You need to wear watch with second hand or indicator. Position the client appropriately. Assist client in a supine or sitting position. Place the client arm next to the body with the palm downward or into the abdomen. This position places the radial artery on the inner aspect of the client's wrist with the nurse's fingers wrist over the artery and the thumb position to the outer aspect of the client. Places 3 fingers and locate the radial artery. Record the result in a JotDown notebook to keep the baseline data and to monitor the client's progress. Obtaining apical pulse, you need to wear watch with second hand or indicator. Position the client appropriately. Assist client in a supine or in a sitting position. Positioning allows ease in doing the procedure and save time and energy that also provides the necessary privacy of the client. Locate the apical pulse. Expose close the area of the chest over the apex of the heart and provide privacy. Cleanses the diaphragm of the stethoscope with alcoholized cotton balls. This will help minimize the spread of infection. Warm the diaphragm of the stethoscope by holding it in the palm of the hands or for a moment. Placing a cold diaphragm over the chest might startle the clients, and it could increase the client's heart rate. Places the diaphragm of the stethoscope over the point of maximum impulse or PMI. So placing it on the right location will provide the loudest and most distinguishable sound of the heart. Auscultate and count the heartbeat in a 1 full per minute. This is to ensure the identification of irregularities of the heartbeat. Record the result in a jot-down notebook to keep baseline data and to monitor clients' progress. Obtaining respiration. With the fingers still in a place after taking the radial pulse, observe for the rise and fall of the client chest. Note for the rhythm and dip and character of respiration. Counting the respiration while presumably still counting the pulse helps the client from becoming conscious of her breathing, which can possibly his usual rate. Starting counting the respiratory rate in 1 full minute. Counting in 1 full minute is necessary to observe the rate, depth, and quality and character. Record the result in a jot-down notebook to keep baseline data and maintain and to monitor client progress. When obtaining blood pressure, ensure that the equipment is intact and functioning properly. Checking equipments prior to performing the procedure, avoid erroneous reading, enable nurse to save time and energy. Wrap the defeated cuff evenly around the upper arm without contraction. The twisted cuff and wrapping could produce inaccuracy. Locate and palpate the bronchial artery with the use of 2 to 3 fingers pads. Position the bell of the stethoscope appropriately and cleanse the earpiece with alcoholized cotton balls and before placing it into the ear. Direct placement of the stethoscope over artery will produce possible sound transmission. Auscultate the client's blood pressure. Pump up the blood until sphygmomanometer, which is to approximately 20 mm above the point where the systolic pressure is noted. Pressure in the cuff prevents blood from flowing through the bronchial artery. Release the valve gradually and listen for systolic blood pressure. Systolic pressure is the point at which the blood in the bronchial artery is first able to force its way through against the pressure exerted on the vessel by the cuff of the manometer. Continue to deflate the cuff gradually and completely to listen for diastolic pressure. Systolic pressure is the point of which the blood in the bronchial artery is first able to force its way through against the pressure exerted on the vessel by the cuff of the manometer. Record the result in a jot-down notebook to keep baseline data and to monitor client's progress.